Hello, my name is Caleb Schuler, and I'm a student physical therapist at Regis University. Today, my presentation is on determining the relationship between muscle force production and angular velocity in the wrist. Now that my big head isn't blocking the references anymore, feel free to pause the video to take a look at the poster. I will be zooming in on different sections as I go along. Understanding the relationship between force production and velocity during different types of contractions is crucial for physical therapy students to learn. One study found that force velocity and power velocity relationships are the ideal parameters to study for determining the conditions of muscular work required. We used concentric, eccentric, and isometric contractions for data collection. The research question was to determine what the relationship between force production and angular velocity at the wrist is. My hypothesis is that as force increases, velocity will decrease. The subject was a 23-year-old female. Our inclusion criteria were smaller people that could produce less force. We didn't want larger and stronger people to avoid having more trials because of our time constraints. The participant volunteered herself after we determined the inclusion and exclusion criteria. The subject's age, sex, wrist range of motion, and length between the center of the wrist to the axis of rotation were all recorded. With her elbow resting on a flat surface at 90 degrees and her arms pronated, her wrist was off the edge of the table in full flexion. She was instructed to extend her wrist as fast as possible while we timed the movement and recorded the results for each trial. Weight was added until she could no longer lift the weight but hold it steady. This is where the isometric range began, and we continued to add weight until she was forced to low it, which was recorded as her eccentric strength. From the data collected, we calculated her angular velocity, her external moment, and internal moments, and used that information to plot a velocity force graph, which you can see in graph 1. The relationship is as force increases, angular velocity gradually decreases. The findings supported our original hypothesis. Another study found that after 3 months of detraining, maximal unloaded knee extension velocity and power increased. But regardless of the changes in force or velocity, there remained an inverse relationship between the two. This could be applied to our wrist extension project that we did. Some of the limitations we experienced were we only collected 3 data points, and that we assumed she had the same range of motion for each trial. In a clinical setting, you'll want to understand the relationship between muscle force and velocity in patients and be able to understand what's abnormal and what's normal. But these relationships between different contractions, forces, and velocities all need to be taken into account when creating exercise programs for patients. Thank you for listening today, and I hope you have a great rest of your day.